All right. Good afternoon, Ditto. Good
Good
afternoon.
afternoon, Anton. Good afternoon,
Yeah.
everyone.
Good afternoon, everyone. Welcome to our Tuesdays with Dr. Joel Lopez, MD. And I'm excited, Ditto, for the topic today. Are you?
Yes, super. So today we're going to be schooled about testosterone and hopefully uncover all the myths that surround this human hormone. Kasi maraming mga misconceptions about the testosterone human hormone. So we'll learn that with Dr. Wellness himself, from Dr. Wellness himself, Dr. Joel Lopez.
All right. Good afternoon, Dr.
Hi,
Joel. Good
good
Afternoon,
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 Doc.
and
guys.
welcome to all of you watching in the replay or in the live stream. Please put your questions on the comment section, whether you're joining us live or during the replay. And we have an exciting topic today. This is a topic that not a lot of people discuss. Parang medyo taboo rin siya. But I think it's very relevant. A lot of our generation are talking about this as well. Dito.
Right. So actually, there's hopefully we uncover all the misconceptions and learn a lot from Dr. Joel today. Kasi nga, marami tayong misconception that or testosterone is drives a lot of emotions in the male, but we don't really know that it's actually part of the female hormone selection ba, Doc? Ano ba tawag doon? How do you call that?
Yeah, it's a hormone that's also found in women, but in really lower doses, lower levels.
Okay. I guess
Yes.
we'll get it rolling. Thank you, Doc. We'll give it the floor to you.
Yeah, so this is quite a long topic. So if we don't, if we won't be able to share it in an hour, then maybe we can continue it next time. But
Okay.
anyways, our topic today is on testosterone. So testosterone is a male hormone, but it's found also in women. So testosterone has a lot of functions, and I would like to enumerate those. So before we go to the screening questions that we ask our clients to find out if they have testosterone deficiency. So let me find those slides quickly. Okay, so these are the symptoms first of testosterone deficiency. So they include low libido or low sex drive, poor morning erections, erectile dysfunction. Even a depressed mood could be due to low testosterone. Fatigue could also be due to low testosterone, decreased vitality, cognitive impairment, insulin resistance, metabolic syndrome, diabetes, abdominal obesity, hypertension, of course, inappropriate body composition like less muscle mass and decreased body fat, also osteoporosis and dyslipidemia or high cholesterol levels. So these are among the symptoms of low testosterone. And if you just go over them, you would think that a lot of these symptoms are treated symptomatically. So most doctors do not screen for testosterone deficiency. But actually, testosterone deficiency or the decline of testosterone actually begins at the age of 20 by about 1 to
Mm.
1.5% per year, or that's
Wow.
10% per decade. So by the time a person is like 70 years old, your testosterone level is actually half of that of your youth. So just some tidbit there. So
Okay.
according to the Sexual Medicine Society of North America, these are the main symptoms of low testosterone. So hypoactive sexual desire, reduced nocturnal and morning erections, reduced sex-induced erections, and delayed ejaculation and reduced semen volume. So these are the questions that we normally ask our clients, and it's called the
Okay.
ADAM questionnaire. ADAM is otherwise known as androgen deficiency in the aging male. So if the person asks or answers yes to number 1 and 7 questions, that means that they probably have low testosterone and we need to pursue this further. So these questions include, do you have a decrease in libido or sex drive? And number 7, are your erections less strong? So those are the 2 main questions that we ask our clients. But these are also other symptoms of low testosterone. That's number 2. Do you have a lack of energy? 3rd, do you have a decrease in strength or endurance? Have you lost height? Have you noticed a decreased enjoyment of life? Are you sad or grumpy? Have you noticed a recent deterioration in your ability to play sports? Are you falling asleep after dinner? And finally, has there been a recent deterioration in your work performance?
Doc,
So,
at
yeah,
age usually nagmamanifest yung ganyan?
what age?
What age?
Yeah, before men usually would experience these symptoms by the age of 60. But nowadays, we're seeing younger men experience this. And because of all the environmental pollutants that we get from, of course, from everywhere nowadays, these environmental pollutants act like hormones in our bodies. They're what we call estrogen. So they're causing a hormonal imbalance in our body. And then, of course, food, like for instance, meat that's been injected with hormones, those could also end up in our body. So that's another possible cause of hormonal imbalance in men as well as women.
How about smoking, Doc? Smoking.
Yeah, smoking does affect hormone levels as well. And I could go over that in a little bit. But anyways, if you answer these questions and you got like 1 and 7 in yes, what would happen is that the doctor would do further testing. They may do either a hormone test through the blood or the saliva or the urine. In the Philippines, what we do commonly is a blood test. And that's usually run at about 8 in the morning because that's when we expect your testosterone to be highest. So ideally between 8 and 12 blood draw. So we expect it to be highest at that time. If it's low and then you're symptomatic, then you're a possible candidate for testosterone replacement therapy. But we could also go over other things that could correct testosterone deficiency. It doesn't necessarily mean that you have to undergo TRT or use testosterone. There are other things that you could also do to improve your testosterone levels.
Okay. So, Doc, going back to what you said, did you say that it's that the surge of testosterone in men is from 8 a.m. to 12 noon?
Yeah, that's when you expect it to be the highest. So that's why we do the blood test at that time. So, of course, we have to do the basic interview and also do a physical exam. So if there's a loss of body hair, an increase in breast size or gynecomastia, a decrease in size or consistency of the testicles, scrotum, penis size, and a decrease in peripheral vision. These are the things that you could see when a person has testosterone deficiency.
Okay.
So the normal value is 300 to 1,000 nanograms per deciliter. So you don't have to wait till your level is 300 before you actually begin treatment, because some people may have low levels like in the 500s, but they may be symptomatic already. And just one thing that people should know, sometimes the first sign of testosterone deficiency is a heart attack in men. Because usually men don't complain because we got this machismo attitude So
Mhm.
we don't go normally to doctors until we really feel bad. But again, since testosterone is also important for cardiovascular health, sometimes, again, the main symptoms could be a heart attack in men. And
So Anton,
sometimes,
Mhm.
this is, yeah. So Anton, this is what happened to me. Exactly.
Talaga? Okay.
Hmm.
yeah, and that was several years ago, Ditto, right?
Yeah. So I took the same test that see Dr. Joel is actually describing, and
Mhm.
I failed on almost all the points. So and it was confirmed that it was actually the heart attack was caused by depletion of my hormones.
Yeah.
Wow. Okay. So, can you take that test anytime lang, ganon? Or it needs to be prescribed? And how much usually would it be,
Yeah,
Doc?
it needs to be prescribed by a doctor, but the best time to
Uh,
have it done is between 8 a.m. to 12 noon.
okay.
Yeah. So
All right.
aside from testing for testosterone, ideally you want to do a comprehensive test for other hormones as well, including your estrogen. You want to also check
Mm-hmm.
for sex hormone binding globulin, prolactin, LH, and FSH, just to get a more comprehensive picture of what's going on.
Okay.
So there are two kinds of testosterone that exist in the body. One is called bound testosterone, and the other one is free hormone, free testosterone. So the total
Mm-hmm.
testosterone consists of the albumin bound as well as the one bound to sex hormone binding globulin. So only 2% of testosterone is free. And actually, this free testosterone is the one that acts at the cellular level. So this is what we really want to test for, is the free testosterone.
Okay.
So I mentioned earlier that these are the ways to test for it. So it's done through the blood. You could also do it through the blood spot, as well as saliva, and also urine panel for testosterone. But here in the Philippines, we usually do the serum testosterone levels only.
Mm-hmm.
Okay, so these are other well, DHEA is another androgen, so we also test for it when we do a comprehensive male hormone profile. So these are the normal values. So our target here is the upper third of normal. So we don't just look at the normal levels because normal values are based on statistics. So let's say they take 9 out of 10 people, then they establish that as normal. So the
Mm-hmm.
normal values for those who live in the States and as well as those who live in Europe are different. Because in
Mm-hmm.
general, Europeans are generally healthier than Americans, so that their normals are actually higher than
Hi.
the American population.
Ang Asians, Doc.
Yeah, it depends. Um, those who have adopted a Western lifestyle or diet would tend to have more of that American
Ah.
values. Yeah, so here in the Philippines, we have a lot of like fast foods and a
Mhm.
lot of Western type of diet. So possibly ours would be similar to the values of that of the North Americans.
Okay.
Yeah. So these are the other tests, but since they're not available here, I'll just go. Let's just go through it quickly. Um, this one says that our free testosterone levels actually begin to decline as we age because the sex hormone binding globulin tends to increase. So that explains why you see more of this symptoms of andropause or low testosterone in aging male population. So there are different ways to crank up your testosterone levels naturally.
All
So
right. Paano yan, Doc?
yeah, so we'll discuss each of these. So it has to do with production, transport, sensitivity, and detoxification of the hormones. So first we begin with production. So how might we increase production of testosterone? Number one there is through weight loss. So
Wow. Okay. Importante talaga weight loss. All
yeah, when
right.
you lose
Yun.
body fat,
Kailangan.
the aromatase enzyme becomes less active, so there won't be any conversion of testosterone into estrogen. And we see a lot of obese men who have higher levels of estrogen, and that is because of the hormone aromatase. Another way to increase your testosterone is through exercise. So exercise has to be done properly. So ideally weight bearing exercises, ideally every other day, and you gotta rest between those days because it's actually during sleep that your body repairs and regenerates itself. Then nutritional support. There are certain amino acids that do help improve your testosterone levels, such as L-carnitine. I think I mentioned that last time, but L-carnitine is an amino acid that, aside from being a fat burner, it also increases endogenous testosterone production, according to an Italian study. Then sleep, of course, helps with improving your testosterone production, and stress management. With stress management, what happens is that when you're under a lot of stress, your body produces more cortisol. And cortisol, by the way, is a similar, well, it also comes from the parent hormone or parent molecule, which is cholesterol. I could go back to that slide. Hold on a second, because this would show how cholesterol is actually a precursor to the other hormones, and that includes your cortisol and testosterone. I can't find it. Oh, there it is. So if you look at this slide, all these sex hormones come from cholesterol. Okay, so cholesterol is not all bad. We actually need cholesterol.
Okay.
But anyways, cholesterol is a precursor to the hormones cortisol, which you could see right here. It's also a precursor to testosterone, estrogen, and other hormones like DHEA, pregnenolone, progesterone, and aldosterone. So if you're under a lot of stress, your body would tend to make more of this hormone, cortisol. We call it cortisol steel, like steel or Rob. So cortisol steel. So if you're under a lot of stress, you make more cortisol, and that affects your level of testosterone. So one thing you do when you have a lot of stress is to correct it, and then that would improve your testosterone levels. And that again is another topic when this cortisol and stress. But anyway, I just wanted to show you guys.
Quick question. When you said that cholesterol is important for boosting testosterone, what kind of cholesterol is that? Is that the LDL or the HDL?
Yeah, what I mean is that testosterone is derived from the parent hormone, cholesterol. So as far as cholesterol is concerned, you have good or bad or oxidized or non-oxidized form of cholesterol. So you want to look at the ratios of the cholesterol. But do you know that the normal or the total cholesterol about 10, 20 years ago was about 300? And they keep on lowering the numbers just to medicate more people. And that's sad because if you lower cholesterol too much, it could lead to other problems. So yeah, it could lead to like hemorrhagic stroke or pancreatic or liver cancer if the cholesterol is too low. So it has to be at a certain level.
What level is that, Doc?
Yeah, so right now the normal for total cholesterol is between 200 to 240. Yeah, and then the ratio, again, you have to look at that as well.
Okay.
Yeah. So going back, so both a low-calorie diet and bariatric surgery actually help to improve your gonadotropins as well as your testosterone. So androgen increase is greater among those who lost more weight, those who are younger and non-diabetic. Body weight loss is associated with decreased estradiol, and that's because the enzyme called aromatase is less active if you have less body fat. So this shows how 52-week treatment with diet and exercise with or without transdermal testosterone among men with METS, metabolic syndrome, and diabetes. So if you just do the diet and exercise without testosterone, you would see some improvement in your testosterone, but it would take a longer time compared to diet, exercise, as well as testosterone. So you get quicker results. So,
Doc, how about
Okay.
detoxification? Will that help?
yeah, we'll go to detoxification later.
Okay.
Yeah. So regular high intensity exercise has been shown in multiple studies to contribute to keeping a man's testosterone at optimal levels. So that's why it's really important to exercise. That's something that you can do for free, right? So in
Yes.
both
Yes.
studies,
But
both
we're
the
all lazy to do that,
groups,
no?
there was a statistically significant increase in testosterone levels after exercise. So there are micronutrients that actually could contribute to androgen, optimal androgen levels. So studies show that you have a micronutrient deficiency, especially in vitamins A, D3, E, zinc, and selenium. It actually contributes to low testosterone as well as low sperm production. So any of those, if they're missing, could actually lead to male hormone dysfunction. If you look here, vitamin A actually regulates germ cell production or differentiation, and it could lead to the generation of both the cycle of seminiferous epithelium and spermatogenic wave. So a deficiency in vitamin A could actually lead to low sperm count. So this is something that you don't hear much from your fertility doctors.
Mm-hmm.
Then there's zinc, which we already discussed last time. It's involved in like 200 metabolic processes in the body. So it's not only important for immune system health, but it's actually important for male hormone health or sexual health. So they found out in a study of 37 infertile men with low testosterone levels and low sperm counts that if they were given 60 milligrams of zinc daily for 45 to 50 days, their levels of testosterone actually improved and their sperm count actually rose from 80 to 20 million. So that's how
Wow.
important your zinc is. And it's important to note that we don't store zinc in our body. So we really have to get it from our diet or from supplements.
Okay. And the natural sources are hong, di
Yeah,
ba? Tama.
oysters and
Oysters.
certain seeds like pumpkin seeds.
And pumpkin.
We have this thing here in the Philippines that if you like had sex one day, you have to eat balot, right? You have to eat
Oh,
balot.
yes. Oh,
Yeah, and also oysters. So oysters are a rich source of zinc. I don't know what is in balot.
oh.
Maybe you could
Ano pa?
educate me on that part. Yeah, because they do
Okay.
recommend it after intense sexual activity, right?
Yes.
Yeah. So this slide tells you how combined treatment of cadmium exposed animals with selenium and zinc actually would show a more significant decrease in plasma and testicular cadmium concentrations. So cadmium is a toxic metal. So you could actually get it from cigarette smoke. So that's how smoking would actually affect your testosterone levels. So
Okay.
it should actually motivate more men to get off of smoking because the cadmium in cigarette smoke could actually cause hormonal issues. as well as
Okay.
erectile dysfunction. So hypogonadism is a major manifestation of zinc deficiency. And although it is rare, it should be considered in patients with poor growth and hypogonadism associated with skin changes and anemia. We lost Ditto. Is Ditto still there?
Wala, nawala siya.
Nawala. Okay. So anyway,
But let's go ahead.
yeah, zinc therapy is actually good for, especially is significant for those who are undergoing hemodialysis. So this
Mhm.
patient is given zinc for about 6 weeks. Their sex hormone levels and zinc plasma levels actually did improve. So this is
Mm,
something to consider.
okay. Doc, yung zinc, can you get it from multivitamins or it needs to be zinc talaga?
Yeah, there's actually some zinc in some multivitamin mineral formulas, but it's not enough. Sometimes there's only like 5 milligrams in there. You actually
Mm,
may need at least 60 milligrams of zinc
per
daily
day.
per day. Yeah.
Oo. Importante yung zinc nga, no? For boosting immune system, for testosterone.
Yeah, and
Galing.
actually a lot of other things, including hair growth. So men who have premature hair loss may actually just
Mhm.
be zinc deficient. And we are actually seeing it in younger men nowadays. I see men in their teens who are actually beginning to
Talaga?
lose their hair. And this is, again,
Wow.
because of a dietary or a nutritional issue. We're not
Okay.
getting enough zinc from our food anymore. And not just zinc, but a lot of other minerals. Because, again, a
Mineral.
lot of our food is not that nutrient dense anymore.
Okay.
So next thing is vitamin D. So the
Mhm.
male reproductive tract is a target tissue for vitamin D. So if you lack vitamin D, it could actually lead to low testosterone. And I've seen this already in my clinical practice. I had a couple of clients who had problems getting pregnant. And this was like
Mhm.
for 3 years. Um, So what I did was just check their nutritional panel. I found out that their vitamin D levels was in the single digits. So vitamin D
Wow.
ideally should be like at least 75 or more. So what I did was corrected their vitamin D deficiencies.
Mhm.
So I didn't mess with their hormones, but eventually they got pregnant. So imagine just
And
something as simple as vitamin D could actually
okay.
correct problems like infertility.
Okay.
Yeah.
And of course you can get it from the sun, no?
Yeah,
Or
you
do
can
you
get
need
it from exposure to sunlight.
Mhm.
And with the lockdown, we could still actually get it from different fatty fish like sardines or salmon.
Oh, summer. Okay.
Yeah. Hmm. So with vitamin D, its impact on low testosterone. So vitamin D use was noted to have a significant increase in total testosterone levels. It increased bioactive testosterone as well as free testosterone levels. So vitamin D could actually improve your total testosterone levels. So men with sufficient vitamin D had significantly higher levels of testosterone and free androgen index and significantly lower levels of sex hormone binding globulin. So that's why vitamin D really is so important, not just for immune system, but for sexual health as well.
Mhm.
So the next one has to do with transport, conversion, distribution, and interaction of testosterone with other hormones. So as we age, there's an increase in sex hormone binding globulin and also a decrease in testosterone due to adiposity or excess body fat or an increased body mass index.
Okay.
So this is what happens. Sex hormone binding globulin is a transport molecule. It's usually increased during pregnancy. So in women. It's also seen in hyperthyroidism. When you have excess exogenous estrogens, these are the ones that we get from our food. Low fat diets, low protein or vegetarian diets. Aging is also associated with increased sex hormone binding globulin. When you do have cirrhosis or hepatitis, HIV, and the use of anticonvulsants. And these are the things that actually uh, decrease your sex hormone binding globulin. So when your sex hormone binding globulin is low, that increases your free testosterone levels. So you see that when you actually use some androgens or even progesterone, insulin, diabetes, and obesity, IGF-1 or growth hormone, exercise also lowers sex hormone binding globulin. The hormone prolactin does that too. When a person is hypothyroid, when they have nephrotic syndrome, and these are herbs like nettle root actually lower sex hormone binding globulin, and the omega-3 fatty acids or fish oils like EPA and DHA, whey protein. That's why a lot of bodybuilders use whey protein, and then certain glucocorticoids.
So, clarification, doc. You need the SHBG to be high or low?
Yeah, we want it low. We want the
You
sex
want
hormone
it
binding
low.
globulin low. Yeah, because if it's high, it would bind it would bind more of the testosterone. So there would be
Uh,
less free testosterone that gets into the cells.
it will be
So if it
depleted. Okay.
so if it binds the testosterone, it will be processed out of the body. Tama ba, Doc?
Basically, when you have bound testosterone, it's not available for use by the cells. So it doesn't do
Mm,
much metabolically. So it's the free testosterone that gets into the cells that's really important.
okay.
So here it tells you that low protein diets, which we see in the older population, may lead to elevated sex hormone binding globulins and decreased testosterone availability. And that's why it's really important to pay attention to your protein intake. And that's what we
Mm-hmm.
do with, we actually recommend a Paleolithic diet for those men who are doing testosterone replacement therapy. And Paleolithic diet primarily consists of meat and veggies and less of the carbs or less of the grains like rice, bread, pasta.
Okay.
I did mention about omega-3 fatty acids. So they
Mm-hmm.
actually lower your sex hormone binding globulin. So that's a good thing. It's a good thing to take the omega-3s.
Mm-hmm. Okay.
So sensitivity, so cellular sensitivity to hormonal signal. So you basically improve androgen receptor sensitivity when you exercise. Again, that's why exercise is really important. And then nutritional support with vitamin A.
Okay.
So yeah, so that again is the
Good.
importance of exercise. Then finally, with detoxification or excretion of the hormone, so aromatase and estradiol metabolites from testosterone, 5-alpha reductase and DHT, and cadmium. Basically, if your aromatase enzyme is very active, your body would form more estrogen. And basically, you see that in people who have excess body fat. That's why it's really important to um, improve your body composition. Then 5-alpha reductase, an enzyme, if it's too active, could also lead to increased DHT, which has been implicated in hair loss as well as prostate enlargement. And then I did mention about cadmium, which is toxic to the gonads or the testicles. So you get that from cigarette smoking primarily. So that's another
Mm,
motivation for men to stop smoking.
okay.
Okay. So what happens when you have excess estrogen? And these are seen in men who have like big bellies or excess visceral fat. So you
Yeah,
see
matataba.
gynecomastia.
Okay.
Sorry.
Go.
Yeah, so you
Go,
see
go.
gynecomastia, um, or in those who go to the gym, you hear it as like men men's breasts, like a, you know that term,
Man boobs. Man
men boobs.
boobs.
Yeah, then you call it like men boobs. Yeah, so you see that in men with excess estrogen. Then
Yeah,
they
yeah,
have
yeah.
increased risk of metabolic syndrome or insulin resistance, and also low libido if you have excess estrogen. So aromatase inhibitors, these are just some examples. So you could also get it from like lignans from flax seeds, isoflavones from soy, resveratrol, grapeseed extract, green tea, quercetin, stinging nettle root. The most popular here is chrysin. It's something that's available in a capsule form for those who don't want to take the prescription aromatase inhibitors such as anastrozole. That's the most common aromatase inhibitor that we give to men. It's quite effective and it's rather safe. So most of my clients who are on testosterone replacement therapy have been using anastrozole. So other
Anastrozole.
aromatase inhibitors include metformin, zinc, and progesterone. So madaming
Okay.
choices actually.
Choices.
So, Doc, do we want to inhibit the aromatase so that our, sorry, I didn't get that. So we
Yeah,
inhibit the
yeah,
aromatase
you
so
want
that
to
we can.
inhibit the aromatase enzyme because if you don't do that, your body would create more estrogen. Yeah, your body creates more estrogen if your aromatase enzyme is very active. And you
Okay.
basically see that in people who have excess body fat. So is that
Okay.
clear? Yeah, okay.
Yeah.
So testosterone metabolites. So there's excess DHT, which has been implicated in alopecia or hair loss, as well as BPH. So to prevent this, we may give 5-alpha reductase inhibitors, but there are natural ones such as saw palmetto, and this is available in like your health food stores. They're good for mild to
What,
moderate prostate enlargement.
what is that? No?
It's called saw palmetto. It's it's a berry basically. You get an extract of
Mm,
that berry, and the dose that you use is like 300 to 500 milligrams per day.
okay.
Yeah. So these are the other 5-alpha reductase inhibitors. So they include krill oil, omega-3 fish oil, stinging nettle root, quercetin, green tea, flaxseed, soy isoflavones, progesterone. Again, chrysin, also popular. Then the prescription medications that lowers this DHT are either finasteride or dutasteride. So those two are available by prescription. I rarely recommend those because they could actually cause some side effects. So normally I
Okay.
use this natural 5-alpha reductase inhibitors.
Okay.
So what are the lab goals to optimizing testosterone? You want to lower your sex hormone binding globulin. So that
Okay.
means more free testosterone. You want to decrease your aromatase enzyme, meaning less
Okay.
estrogen. You also want to decrease your 5-alpha reductase enzyme, and that would lower your DHT. And then you also want to test and optimize your DHEA. pregnenolone, LH, and FSH.
Okay.
So these are just like recommended dosages on the different bioflavonoids as well as medications. So now we go to testosterone replacement therapy.
Okay, Doc, before you
Yeah.
go there, so yung green tea, that's good for testosterone, essentially. Tama ba?
Yeah, by improving your liver function, basically. That's how it
Mm,
improves your testosterone. Because
okay.
you produce less sex hormone binding globulin when you do have green tea.
Okay.
Okay? So now, for those who cannot wait to improve their testosterone levels for months or years, they could actually do that by using testosterone in injectable form. So we have either the enantate, cypionate, or propionate form. The medium-acting ones are enantate and cypionate. Propionate is short-acting. That one has to be done daily. Whereas the medium-acting ones could be done like once or twice a week. So this there's another popular testosterone in the market called Sustanon. It's composed of short-acting and short-acting, medium-acting, and long-acting forms of testosterone. And that's, as you
Okay.
can see here, it could be given every 2 to 3 weeks. But in my practice, I use mostly the medium-acting ones,
Which is this
um,
one,
which is
Nebido.
the cypionate and the enanthate. The first two, those are the medium-acting ones. Then this Nebido is long-acting. It's given every 3 months. There's also other forms of testosterone, like what we call
Subcutaneous.
testosterone pellets. This is basically like the size of a grain of rice and implanted under the skin. It's basically absorbed slowly into the system. There are some men who prefer this, but most of my clients still do the injections. Just FYI. Yeah.
Mm.
And then for those
More
who don't want
effective.
to do, pardon me?
Is it more effective yung mga injectables
Yeah,
than
the
the ano?
injectable is more effective. We don't recommend oral testosterone because they could actually damage the liver. So it's no longer in use. Yeah, it's called methyl testosterone. So another option would be transdermal testosterone, which is applied to the skin. It's available either as a patch, gel, or cream. But the tendency for topical testosterone is that it converts more to DHT. So you see more hair loss with this type of testosterone treatment. So we generally don't recommend transdermal form of
So,
testosterone.
Doc, for the one that's subcutaneous, the one that's like the size of the grain of rice,
Yeah, it's a
when you
pellet.
implant that, when you
Yeah,
implant that, is it, sabi mo 3 months, no? Is it going to be like time released?
yeah. So you don't have to remove it because it's actually gradually reabsorbed. I mean, it's gradually absorbed into your system.
So with that, Doc, the one that you implant, do you still need to take the estradiol to balance off your estrogen?
You mean the aromatase inhibitor?
Yeah, I'm sorry,
Yeah,
aromatase.
yeah. You still need to do that. The only advantage is that you don't have to poke yourself every week if you do the pellets.
Mm.
Yeah.
Okay, thank you, Doc.
Okay. Yeah. So this the oral form of testosterone. It's called methyl testosterone, and it's hardly used anymore. I don't know of any doctor who's recommending it. At least not that I know of. And these are
Okay.
SERM. These are other things that may raise your testosterone, but I don't really recommend much of these. But anyways, so side effects naman ng testosterone. So no cardiovascular risk. Actually, it helps improve your cardiovascular function.
Okay, that's
So
good.
yeah, it has an anabolic property. So it may raise your red blood cell count. That's why every time I recheck a person's testosterone, I also check for their hematocrit levels. And if their hematocrit level is high, I may recommend therapeutic blood draw, which is actually
Okay.
good for your liver too. Infertility could happen. Again, this is possible when you use testosterone chronically, like nonstop. So sometimes I
Uh-huh.
give my clients like a break. Uh, so sometimes they do it for 6 months and 6 months and stay off of it for 1 month. Otherwise, they could also use something called HCG. So this HCG would actually increase the endogenous production of testosterone. This HCG doesn't cause your testicles to shrink. So um, this is another way of raising your testosterone.
Doc, the HCG is the one that you inject subcutaneously, right? That's
Yes,
self-injection. I
yes,
remember I took that.
yeah. Then a rare side effect of chronic use of testosterone is smaller testicles. Some men are not bothered by this. It's more of like aesthetics. But for those who are bothered by it, it's actually reversible.
Mm.
So once you stop the testosterone, it would go back to its previous size. And then another way to prevent it is by using HCG along with the testosterone.
So, Doc, just to be clear, men actually like smaller testicles so that it's nicer to look at.
No, no, no. I mean, it's a side effect of a chronic use of testosterone. So
No,
for
because
some men, they're not
aesthetic.
bothered. Some men
Okay,
are not
sorry.
bothered by smaller testicles.
Okay.
Yeah. Okay.
Okay.
So
Sige,
this
Doc.
one, liver damage only from the oral form of testosterone. That's why we don't recommend it.
Okay.
Acne is possible. BPH. There's no evidence of testosterone causing BPH. Actually, it's the estrogen that causes prostate enlargement. That's why it's really important to use some aromatase inhibitors when you're on testosterone replacement therapy. And then gynecomastia or men boobs may decrease due to fat loss, but may increase due to aromatase enzyme. So benefits of high testosterone is that it helps relieve depression. This is based on a Harvard study. It improves
Nice.
memory and concentration. It improves sense of well-being. It may lower cholesterol. It improves libido or sex drive. It actually
Mm-hmm.
makes your heart stronger. It improves sleep. It helps improve your body composition. And it also gives you a chiseled look and
Wow.
increased
Okay.
Mm-hmm.
So,
bone density.
yeah. So natin ang Joe line.
Yeah, so madaming benefits ang testosterone.
Wow.
Okay.
Okay. So, Doc, is
Um.
that like halfway of your presentation?
I do
Yeah.
have more, but I think that's it.
That's
We
it.
could actually do the Q&A now.
Yeah. So Robbie, what are your questions? Robbie's tuning in. Maybe put your questions there. So Doc, question lang. For testosterone, is there a certain type of doctor that you should go to
So,
Yeah,
Doc,
or a specialist?
yeah. In my case, kasi I did study anti-aging and regenerative medicine, so
Okay.
um, possibly you could see an endocrinologist if you're interested in doing testosterone replacement therapy. But again, sometimes they just base it on the normal values. So if your normal values, if your levels falls within normal, even though it's like 300, you may not be treated because sometimes they only look at the numbers. But of course, there are more open-minded or forward-thinking physicians. They may not necessarily be endocrinologists, but anti-aging or integrative medicine specialists. These are people that you may want to visit. So an integrative medicine doctor has some background in complementary, alternative, or holistic medicine. Just FYI.
Okay. Ito na yung question ni Robbie. Okay, maybe we can... Dami yan tanong. The first question, is it true that lifting weights increases testosterone?
Yes, it does.
And then yun muna. First question muna, Doc.
There's an honest question there, Doc. Nababasa mo ba? Does masturbation help increase testosterone?
Does masturbation help increase testosterone? Actually, according to some studies done by the Taoist, supposedly if you... I'm sorry, my dog is like... I need to...
Reacting.
Give me a minute. Give me a minute.
Okay.
So,
Na-excite yung...
Na-excite yung dog na dun sa topic. Si Robbie kasi question number 2. Anyway, ano yung question number 3 niya, Anton? What was question number 3?
Ikaw na magtanong.
Okay.
What are the signs that see your...
Okay, so si Rob kasi I think he just plugged in, no? Yung diniscuss ni Doc yan, you see it parang gyno, ano ba yan? Yung sa man boobs, you'll see man boobs, and then yung increased body weight, that's another thing, and yung what else pa ba? Yung I remember when this is a side story. Habang natin si Doc, I remember when my testosterone was really low and my estrogen was high. Mas mukha akong babae sa mukha, facial features. So, and I shared earlier that the first thing that a decrease of testosterone hits is actually your heart. And then hindi pa natin na-share ni Doc, but also your respiratory system. So, when you develop like a cough and you don't know what the source is, yung kuminsan it's also a depletion of the testosterone in men. So I tried everything that hindi naman everything. I did the injections, the injectables, and yung oral. And nakasama yung oral, I remember, sabi ni Doc. And yung...
I'm back.
Yes, thanks, Doc.
Yeah, sorry about that.
Hindi kinain ng yung question mo ni Robbie.
Yeah, so back to his question. So if a person ejaculates a lot, they lose a lot of the mineral zinc. So zinc is important for testosterone function. So that's why you don't want to ejaculate like on a daily basis unless you supplement with zinc. Yeah, so that was an honest answer to an honest question.
Real talk. Yeah, real talk.
Yeah.
So Rob, not every day, Rob. Okay. Just to be clear.
I would say your testosterone is low physically. So madaming signs. So number one, Jen, is poor body composition. So if you have more body fat and less muscle mass, so that's one sign that you may have low testosterone. And then, of course, other things like if you're starting to have problems with your hair, like hair loss on your head, as well as hair loss in your extremities, that could also mean that you have starting testosterone deficiency. So Yes.
You also mentioned, Doc, the small testicles.
The small testicles, yeah, that's from too much, chronic use of testosterone. That's a side effect. Side effect naman yun. Hello?
Is there a food that we can take to increase testosterone? Because he remembers that his hairy legs, when he started gaining weight, nakalbo yung legs. So, kaya baka pwede na makainin. So, what are the food again, Doc?
Yeah, more protein primarily.
Okay.
Whey, I remember you said whey is very important. No? Whey, protein whey and shakes is very important, Doc. Tama ba? Okay.
Paano, Doc, vegetarian ka? Paano yung protein source?
If
Plant-based.
you're vegetarian, you got to make sure that you try to vary your food intake, because if you don't, you may end up with a lot of like nutritional deficiencies, and that would include deficiency in certain amino acids. So that could lead to problems with hormones as well.
So, Doc, if you're vegetarian, you said that. Wait, am I? So, if you're vegetarian, you could take L-carnitine, right? L-carnitine, and I think you mentioned omegas, DHA, EPA.
Yeah, if you're a vegetarian, then you may benefit from taking some L-carnitine, because again, L-carnitine would actually help improve testosterone levels, as well as it's also a fat burner.
Doc, how about niacin?
Niacin is good. It helps improve with circulation as well as your cholesterol picture.
But whenever I take niacin, I get like flushes. Sa mukha, I get like hot flashes, and then yung nagkaka-flush ako, like a red flush.
It's actually a common side effect of niacin intake. It does that because it's actually improving your circulation. So you like get red or itchy sometimes, but it's transient. Normally, it only lasts for 30 minutes or so.
Okay. All right. Let's close this, but can we have a photo again, guys? Okay, 1, 2. Doc. See Doc. Doc, 1, 2. All right. All right. What else, Dito? I think we've answered all raw-based questions. Thank you for that. And I know this is a very touchy topic, but I'm sure a lot of people will watch this in replay, and I do hope it helps a lot of people, no?
Yeah.
So yung last question na lang, Doc, yung mga Viagra, hindi yan testosterones related, no?
No, what it does is that it increases nitric oxide levels. So bali, it improves lang the circulation to the penis.
Okay.
Yeah, if someone wants to avoid taking prescription medicine, they could actually take the amino acid called L-arginine. So that would also help improve circulation to the penis, therefore improving erectile function.
Ano yan?
L-arginine.
Injectable?
Yeah, L-arginine.
I think it's oral, no?
Yeah, it's an amino acid.
L-arginine.
Amino acid.
L-arginine, yeah.
Oh, tandaan mo yan dito, ha? L-arginine.
Ako nandiyan ko kailangan. Oops, sorry. Dapat naka-mute. Anyway, so yung
Thank you,
Doc, you said that the erectile dysfunction is it also yung physical, that's the way you know that your testosterone is low, the erectile dysfunctions?
Yeah, people who are not getting morning erections may have low testosterone, because normally men get morning erections kasi
Hmm. Okay,
Yeah,
I
so
think
this is one
naiiwan
of
ko
the
muna yung
signs.
question eh. May nagtatanong sa Facebook because nahiya sila mag-ask, do women have testosterone? I think we answered that already.
Yeah,
Meron certain level na doc.
women have
Doc.
testosterone as well. Ang role ng testosterone in women is for libido or sex drive, as well as for improving their bone density and energy levels. So they
Okay.
do have testosterone, pero it's only a fraction that of seen in men.
Okay. So what happens, Doc, kasi na-mention mo kanina, when male has a depletion of testosterone, you can have a heart attack or you can have like problems. No? Pagka sa babae, Doc, if they have like an increase of testosterone, what happens to them?
Yeah, usually initially they may experience aggressiveness or irritability. Then eventually they could have like lowering of the voice, hair loss, and then cardiovascular problems. Same thing with men. If you have too much estrogen, you could have cardiovascular problems. That's why men really have to have low estrogen levels. And you could lower that by, of course, improving your body composition and taking certain aromatase inhibitors. And I mentioned some of the natural ones and prescription ones earlier.
Yeah. So next time, Doc, baka we can talk about the myths that surround testosterone. I know it's an hour already. Baka we can talk about those myths kasi ang dami niyan eh, di ba?
Oh, madami. Pati actually, if kung may time pa tayo, I could show you some of these other slides.
Next time, Doc. So,
Next time,
maganda to dedicate a whole show for that kasi I think that show will be really interesting to a lot of people.
yeah. So,
what do you think?
are we good?
Yes, we're good.
All right.
We're good,
Thank
no?
you. Thank you. Thank you.
Thank
All
you.
right.
I hope
Thank you,
I've been
guys.
able to enlighten everyone.
Everyone, see you soon.
Yeah,
Bye.
thank you. Thank you, guys.